Aloha kako, and thank you for joining us this evening. COVID POW is an initiative of the Hawaii COVID Collaborative, a community-led hui working on behalf of our friends, neighbors, and families to deliver the information we need to beat COVID-19. We believe good information empowers kama'aina to make informed choices that protect our health and help our state to become more effective at controlling the virus. We're here for a town hall discussion, the first in a monthly series. Here's why. COVID POW connects residents with trusted experts, and tonight gives us a chance to get direct answers live and in real time. Our panel is comprised of leaders in their fields and partners in the Hawaii COVID Collaborative. Representative Scott Saiki, Speaker of the Hawaii State House of Representatives. Peter Ho, Chairman, President, and CEO of Bank of Hawaii. Ray Vara, President and CEO of Hawaii Pacific Health, and Dr. Jill Hoggard Green, President and CEO of Queens Health Systems. And I'm Naʻalehu Anthony, COVID POW Director, and I'll be moderating tonight's discussion. Thank you all for being with us tonight. Questions were submitted in advance throughout the week via email and through social media. The questions have been grouped into key themes that will guide our discussion this evening. First, how the virus impacts economics, how our social well-being impacts public health, how public policy and personal responsibility are intertwined, and how the national pandemic issues will impact us in Hawaii. Please continue to ask us questions live throughout the event, comment on our Facebook live stream, or message at COVID POW on Instagram. We will look to address more questions in coming weeks. Check covidpow.org and social media for any questions that we don't get to in our limited time tonight. So let's dive in. I'd like to ask our panelists to share an opening perspective to help us set the tone for this evening. We'll start with Speaker Saiki. The question is, what is the role for our elected officials, private sector, and nonprofit leaders in charting a path forward in an uncertain set of circumstances? Speaker.
Thanks, Na'a, for inviting us tonight. So when the legislature was in session a few months ago, and when the pandemic hit, it was just, as you know, it was an unprecedented time for us, and nobody knew exactly what to do. So before the legislature had to shut down because of the spike, the House of Representatives created a select committee on COVID-19 response. And the purpose of the committee was to bring together legislators, representatives from the private and nonprofit sectors to basically plan for the economic ramifications that our state would be facing as a result of the pandemic. And Peter Ho agreed to co-chair our committee. We've been meeting since March. We have developed subcommittees that are focused on some of the top priority areas, such as housing and rental assistance, the medical response, and also communications and strategy. And this committee is an example of I think a public-private partnership where we are joining forces because the state government can't do this alone. We need the resources and expertise of those in the other sectors in Hawaii. Thanks.
Thank you very much. I'd like to ask Peter Ho, as we take a holistic look at Hawaii's well-being, economic, social, and public health, all-encompassing, where are we strongest?
Yeah, that's a good question. Thank you, Lehu. I think that the important thing to understand is that each of these factors are critical to each other. If I were to rank them, though, I think that squarely our social environment is probably our strongest element right now. Hawaii is a small place. We're a community that's used to pulling together in times of crisis. We're our neck of the woods out here in the middle of the Pacific isn't immune to all sorts of crises. So to a certain extent, we have some history there. So I'd say that's probably strongest. Secondly, I think our public health posture has improved greatly. So probably not where we needed it to be on the front end, but I think we've made up ground. And sadly, I think our economy is probably in last place. And it's important to recognize that we went from the best employment situation in the country going into COVID to just about the worst because of the visitor component of our industry. And really, it's going to take each of these three elements to work to bind together to come up with the best outcome here.
Peter, thank you. I'd like to turn to Ray now and ask, why was COVID POW created?
Thanks, Naʻalehu. I think early on when we started engaging with the community via the select committee and watching the life of the virus during the early days back in March and April, it became clear to us that communication was going to be key, and that and frankly that there were some voids in that regard, and there was an opportunity to create a multi-channel platform in order to help drive solutions to that end. And as we got together with the Hawaii COVID Collaborative, we really set out to, most importantly, bring clarity where there was confusion and avoid adding confusion where there was already clarity. And so we knew with the collective strength of the organizations that were represented in the collaborative that we could reach a large portion of the population through our various stakeholder groups. And so COVID POW really grew out of that, meeting what we saw is the most critical need in helping our community be equipped to manage what was necessary, both from an understanding standpoint, as well as from activating them to do what was right for themselves, those around them, their loved ones, and others that they came into contact with.
Thanks so much, Ray. And the last question I have is for Jill. What are some of the most critical lessons that have been learned to date for the public health response to COVID-19?
Mahalo, and thank you for that question. I believe that we individually and collectively as a community can impact the spread of this disease. So I always start with, what can we do personally to protect ourselves and our ohanas? And it's simple. We need to be wearing our masks. We need to be washing our hands. We need to keep very large physical distances of usually 6 feet. And I add this year, we need to take our flu shots to reduce the potential of more infections than just COVID. In addition, we need to be very careful if we have symptoms to stay at home and call our healthcare provider so they can get us access to testing and help navigate our care as we proceed through that disease. I support, and I believe I speak on behalf of all of my colleagues, we support a statewide state mask mandate, and we want it simple and easy for us to follow across our beautiful state. That's the single most important thing we can do collectively to be able to reduce this disease. In addition, there have been some excellent suggestions on COVID POW. We're approaching the holidays, and we know the disease spreads as we come together in groups. That limit of 5 people is there for a reason, because it can, as you have more and more individuals that you're communicating with, it's easy for the disease to be spread, even if you don't know, because you're asymptomatic, you don't know you have the disease. So please keep the gatherings to lower than 5 and be very careful and follow the recommendations you see on COVID POW. In addition to our own personal activities, we need to have our community and our government work together. And I'm actually very grateful. I just joined the state about a year ago, and I have colleagues across the country. Many of them are in states where there is not health care systems and government working together. And collectively, they have a lot of disarray in their states, and we're seeing significant surges. We are working together. And what we need from public health, and we are getting, is we need significant ability to test. And from the beginning, we've added significant capacity both within our health systems as well as within our government to be able to rapidly test. We need contact tracers. And at this point, I believe I heard today we have over 300 contact tracers, and I also heard that it could be closer to 400. And that's needed because once the disease spreads, as rapidly as we can get a test, and then actively identify everyone that's been in contact with that person, we can isolate not only the person with COVID, but the individuals in contact. And then they're in a position to get tested and stop the spread. This contains the disease. It's the single most important things we can do right now that will rapidly change the scope of this disease and the amount of pain and suffering that happens in our community. So I look at this as we have the tools to be able to impact this disease, and individually and collectively, we're in a great position to do it.
Mahalo nui, Jill, for those comments. And mahalo everybody for these insights and laying the groundwork for the conversation tonight. Let's turn to the discussion of how the virus impacts our economic health, starting with this video from small business owners of the restaurant Wagaya and how they're navigating the reopening.
パンデミック前はすごい順調で、お客さんに、そうですね、いつも来ていただいて、賑やかで。
The energy that the restaurant had, there's just this sort of like upbeat, like moving forward, sort of just unstoppable energy.
すべての流れが止まるような気持ちになりました。なんか
And we're just like, oh no, what are we gonna do, you know? And then Central Pacific Bank does this Keep Hawaii Cooking promotion. It was just me and Tara, and then maybe like one or two guys in the kitchen helping, and all of a sudden, Friday night, we get like 100 people ordering for the same time. There's like 30 people outside, and I just start crying, and I just felt so bad. You know, we run the restaurant to make people happy, and so it's hard to disappoint people for us. So.
なんかもう最初の日はお客さんがテーブルに座ったのを見ただけで僕は嬉しくて涙を流してしまいました。
Remember, no large gatherings,
social distancing,
and mask up.
Okay, so Carl Bonham, the executive director of UHERO and a member of Hawaii's COVID Collaborative, has told us many times that the virus prevalence directly impacts economic health of our economy. As we reopen workplaces and reinvigorate local commerce, we know that the biggest risk to reopening is a spike in cases. Our economy and public health are intertwined. And so the first question I have is for Speaker Saiki. Why open tourism, but not the businesses throughout the rest of the islands first? For example, why was it okay to let tourists fly in, but we couldn't let arcades reopen?
So let me just say that to start off, that we know that public health and safety is a top priority for residents in our state. They're very concerned about the health of themselves and their families. And given that when it came to reopening the economy, the fact of the matter is that tourism is our largest industry, and as we've seen through this pandemic, tourism impacts not just hotels and airlines, but there are a lot of other businesses down the chain that benefit from tourism. And these are small mom and pop businesses, local businesses. It's the restaurants, distributors, stores. And we felt that this was an area that tourism needed to be reopened first, because it would be, given safeguards, it would be the more practical area to reopen before any other sector.
Yeah, Naʻalehu, maybe if I could jump in on that. I think the speaker is spot on. You know, what I think everybody has been really trying to do during the course of the pandemic is trying to find that sweet spot between public health and the economic health of the community. And I will tell you, it's an ongoing learning process as we try to figure out how to navigate. And some of that has to do with the life of the virus itself and how it spreads through our community and how it spreads through other communities. We certainly know that you increase risk anytime you increase activity throughout the community. But as long as we understand what's going on with prevalence rates for travelers coming in, and we layer on top of that risk mitigation impact tools like the pre-travel test, I think it's probably the best way to go to find that balancing point between the public health and the health of the economy. The truth is, we learn from this and we understand that that all activities that are going on throughout our community, whether it's restaurants, gyms, gatherings of various sizes, all of those carry different risk levels. And so hopefully we're able to activate the community in a way that helps with the economic situation in a very strategic fashion through the activities in which those who are activated are allowed to participate in.
Thank you so much, Speaker and Ray. The next question I have is for Peter Ho. What happens if there's spread in workplaces? And as people come back to work, how do we make sure that those places of business are safe and do not help to spread the virus?
Yeah. So Carl Bonham, who's doing great work with UHERO on the economic front through this crisis, is fond of saying that the virus is the economy, and that's a really important fact to internalize for each of us, because it really, I think, puts the responsibility squarely on the backs of us as individuals within our community. And so, people are quick to say, gee, any shutdown, or if you go from this tier to that tier, you're really going to impact the economy. The reality is, what really impacts the community is infection rates in our community, and as those peak up, we do see economic activity drop off, and it's not so much the policy action that's driving economic impact, it's just the rate of infection. So I think that's a very important understanding, Naʻalehu, for everyone in our community to internalize. And then as it relates to individual businesses, policy directives are put out there to help control the infection, and they are based in science. And so what I would say is that, if you're a business that is able to operate, it's important to make sure that we're falling within the capacity constraints put upon us by these policies and by policymakers, because they are based in science. And really, in the end, it's having a half of capacity is better than having no capacity at all, or having 2/3 of the capacity is better than having no capacity at all. And it's these little steps, these little fractions, if you will, of economic activity that are going to allow us to stitch our economy back together.
Thank you for that, Peter. Jill, the question I have for you is, the 7-day average is up this week. Do we know why that is? And will there be another shutdown with a surge this fall?
Yeah, that's an excellent question. And I think my colleagues just did a beautiful job of talking about the balance between health and our economy and mobility. We know that as we gather more, whether we're going back to school and doing all of our appropriate precautions, whether we are going back to work or having just more mobility as a community, there's just going to be more contact. And when there's more contact, there's potentials for gathering, and it increases the possibility that there can be spread. So what's important is to watch the rates. And as you go back to the COVID House site, I watch the positivity rate, which is staying pretty reasonable right now, around 1. And you watch the rate of positivity of the testing that's occurring. Now, every one of us are looking at our news, and when we look at what's happening on the continent right now, on the mainland, it's very discouraging. We have lots of communities that are in a very massive surge. The surge in the fall is well predicted, and it's predicted because so many people are gathering, so many people are going back to school, so many people are going back to work. And if you look at pandemics across the last decades, there's usually been a fall surge. At many of our health systems, and I know that Ray does this as well as at Queens, we have really good analysts who have been predicting how the disease can display itself and come into our community. At Queens, we do predict a fall surge. However, and this is most important, we have the tools to prevent it if we're following those protective rules from public health. If we're wearing our masks, keeping social distance, there's dramatic impacts in terms of the rate of slowing down any spread of disease. So when you talk about a surge and what we can see if we don't do that, it will be a larger surge than what we just experienced. But we know how to control it. So right now it's very much in our hands and our behaviors and the way we manage at our work sites, all of the good work that our restaurants and our vendors are doing, all of that will help us mitigate from a potential surge. Now, you asked the question about a lockdown. And a lockdown happens when our health systems are overloaded and we don't have the ability to be able to provide the right care. I believe that we've worked very hard, and I want to speak for all of our health systems, Ray's team at Hawaii Pacific Health, Castle, Kuakini, Wahiwa, all of our Kaiser, all of our teams have been working together from the beginning of this pandemic. And I believe that we've used the time to strengthen the systems and can talk further about how we're doing that to make sure that we're in a position that if we have a surge, that we're prepared to care, and we have been expanding access to do that. And I want to acknowledge our state and federal partners. They have been tremendous assets and partners during this work, both during the surges, making sure we can get access to staff, and making sure that we had access to the appropriate supplies. And better than any community across the country, I believe that we've had the support to be able to face this devastating disease.
So we're getting questions in from Facebook, and I wanted to pose this question for the speaker. Can you comment on travel surveillance and whether or not it's been working or not? This is from Ingrid.
Travel surveillance meaning?
I think that has to do with the random testing that they're doing.
Oh, the random testing on, yeah, so the random testing is, so this is my position was that a post-arrival test isn't the most practical approach, because if we're requiring travelers to take a pre-test before arrival, then that should be sufficient for the most part. The post-testing that has been gone on neighbor islands has not produced a lot of positive cases, and that also applies to the surge testing.
Thank you.
Naʻalehu, I think that really speaks to the fact that the 72-hour pre-travel test has been quite effective. And so that's the result that we would hope for, is that the fact that we have a test, and then the fact that the far majority of those tests have come back negative, tells us that the prevalence rate of those coming into our state continues to be extremely low. In fact, exposing very little risk to the residents as they come into the community. Again, understanding it's not going to be zero, which is why you'll continually hear all of us say that it's about how we learn to live with the virus and manage the virus when identified.
And what we saw, I think we saw in the spring when cases had spiked, was that there probably were more positive cases as a result of Hawaii residents who had traveled to the mainland and then returned with COVID, as opposed to travelers bringing COVID to Hawaii.
Okay, thank you for that, everybody. This is a great segue to our next discussion set, which is how social well-being impacts public health. The video we see next illustrates some of the challenges families experience firsthand.
Louisa Lee is my official name, but most people know me as Sasa. I grew up in Keaukaha. I'm a mom. I have 3 boys, ages 12, 8, and 4. I was identified as a close contact as was my sister. As soon as my sister tested positive, I knew immediately that I was gonna be positive. I took my test on a Tuesday, and then on a Friday, I was confirmed as positive. This includes me, this includes my ohana, and my bubble of people. The Department of Health pushed this bubble idea, and so I think families and communities were under the impression that my bubble is safe. And I don't know if all of us really thought about like, but how big is your bubble? Because your bubble is not just your ohana when you live in Hawaii, when you live in a small community, right? Your bubble could be very, very large. I really, really believe that like in communities that rely on each other for childcare, for kupuna care, for food, right? We're all trading off to kind of make this work. And I cannot speak for everybody, I can just speak for myself. But I do feel like when you're around people that you love and you trust, that you let your guard down. I really feel like we need to work harder. And when I say we, yes, community, but also government, to put systems in place that allow people to make their bubbles smaller. I immediately contacted the people that I thought that I had been in contact with. I just called them and said, this is the situation, so that they could make an informed decision for themselves. I was so apologetic, and everyone I spoke to was like, it's not your fault, don't be sorry, it's okay. Thank you so, so much for telling me. So I think by and large, that's the reaction. I've been very open and transparent because I just want people to be like, talk about it, it's okay. If you want to protect the people that you care about, if you want to protect your community, let the people know.
What we all love so much about Hawaii is the importance of pilina, the relationships that bind us and the values that tie us together, especially now when dollars are tight and the mandate of compliance can be challenging. In so many situations, our community members rely on each other in order to make it day to day. Finding new habits, new patterns of behavior, this is critical. We can't lose who we are or let down those who depend on us. And we have to prevent transmission in order to protect those we love. So this first question is for Ray. And the question is the COVID spread mostly gathering in clusters, or is it in non-compliance with other safety precautions?
Yeah, that's a great question, and frankly, a rather complex one, Naʻalehu. I think the answer is all of the above. I mean, of course, gatherings we have heard through a number of different stories and experiences can be a problem, and likely are a problem with the virus, with given the nature of COVID-19. But I think Jill really nailed it earlier when she spoke and said, look, if we limit gatherings, if we mind all of our personal responsibilities, like being diligent about wearing masks, making sure we're social distancing, practice good hand hygiene, stay home when you're sick, you get the flu shot, that coupled with our public health infrastructure doing all the things that we expect them to be doing, we will be in pretty good shape. And those things from the public health infrastructure are really about having a strategic testing plan, make sure that we're able to do disease investigation and contact tracing, where we have the ability to quarantine and isolate. And so I think that's something you're going to hear all of us continue to speak of. And while we know that we struggled with some of those public health issues early on, as many folks said earlier, we've seen great progress in that regard. We've built up the ability, and I think a great example, but which we haven't talked about enough, was what happened on Lanai just a few weeks ago. While there was a gathering and it caused some challenges and it caused some spread of the virus, and it was significant for an island with a population the size of Lanai, the fact is that didn't grow out of control. We didn't see it grow to 3, 4, 5, 6, 700 cases, because the public health infrastructure and the people of Lanai did a great job responding. We actively deployed testing. We were able to contact trace, understand where it was coming from, and quarantine and isolate. And when you're able to do all of those things, we then find ourselves to be in a position to be able to live with the virus as we reactivate our communities.
Thanks so much, Ray. Jill, the next question is for you. And it really speaks to some of the challenges that we've had with our keiki. How do you think social isolation will impact our children? And do you see any negative health consequences that extend beyond COVID because of these lockdowns?
Thank you for that question. And it's a very important one. We're all living through the pandemic, and it can take a toll on our physical health and also our emotional health. And it's absolutely applies to our keiki. I love that we as a community have a lot of aloha, that we love and demonstrate compassion every day. We want to gather together. We want to be supportive of all of our ohanas and our friends. But as we said earlier, in a pandemic, having those kinds of gatherings can actually transmit the disease. So that isolation that our keiki are having, that many of us have had, has led to what I call the second wave of COVID, which is anxiety, depression, a feeling of isolation. And then for keiki, if you think about our children, if they are both isolated from their friends and they're stressed in the household because a loved one doesn't have a job, and so there's worrying about their financial security or their ability to have appropriate food and housing for their family, all of that can be felt directly by our children, by our keiki. So it's very important that you talk about it, that you encourage your keiki to express their feelings. It's important that they are connecting socially through Facebook and FaceTime and all of the methods they can be seeing their friends virtually. It's important to help them exercise and maintain routines, and to recognize that this can be a very scary time for them. And if you're seeing a behavior change in terms of them withdrawing, that you seek help, that you call your pediatricians, or many of us have mental health services. Our state has mental health services. Call and get some support in how you can best support your keiki, because we will walk through this, and they are. But recognize that many of us as adults have a lot more tools about how we deal with challenging situations. And we have to be advocates for our keiki to help them have a healthy life as we walk through this.
Thank you so much. I'm reading one of the emails that came in, and I'm going to follow up for you, Jill. This is from Corey. And they're asking, opening schools too early in an unsafe way can have major repercussions on the health and safety of our communities. Also, opening and closing schools has happened with several campuses due to COVID-19 and will cause increased stress for working families. How do we strike the right balance?
Very, very important question. And it goes back to, we're balancing health and making sure that we're able to do as much as we can effectively as a community. And school is very important for our children. First, we need to make sure that we've done everything we can, as we talked about earlier, and Ray mentioned again, that we're doing everything we can to reduce the transmission of the disease as a community. That's very important. And you've done that very successfully over this last couple of months. Second, we've got to make sure our schools are well prepared. We know that there are protocols that we need to have within our schools. There are some very good standards of what they can do to make their environment safe and effective. We do need to be using masks, and ventilation is actually really important. One of the things that is quite clear is the more that we can be doing outside, and we are one of the few communities where you can, the better it is for our kids. So balancing our environments and making sure that our environments are safe, and assuring that we're keeping physical distancing, and that our kids, as our kikis, as well as our educators, have the appropriate, what we call PPE, which is the masks and head protectors, face protectors that help prevent the spread. All are the same principles that we use both with adults, as well as with within hospitals. So again, be vigilant in your own personal protection of your keiki. Hold your schools accountable and us accountable for providing the support to them. And we'll keep every day and every week monitoring our rates of transmission, and keeping that stable and managing it will make for an environment where our keiki can learn and return to normal within all of the new protocols that we have.
Thank you so much. This next question is for Peter. How dangerous is it really to gather with my extended family this holiday?
Peter, you're on mute.
Sorry, Naʻalehu. That's such an appropriate question, especially this time of year, and it's a tough one because we're all 8 months into this pandemic, and COVID fatigue is a real thing. It's kicking in, and we want to interconnect. I think as Jill was describing earlier, that's just our nature, and that's certainly the nature of our community. But the reality is, this is an indiscriminate virus, and it will fester in large gatherings. And so it's important that we respect and think through the policies that are put forth and limiting gatherings, and therefore that means pretty much sticking to our nuclear families is critical at this time. And it's important to, it's easy to wish that this weren't the case, but the reality is this is the reality of the situation. And what's really in the balance is our economy and our way of life and small businesses and people's livelihoods. And I hope that when people think of that in that dimension, that it begins to at least balance some things that we know, it's just human nature to want to push the boundaries on. But it is dangerous.
Thank you so much, Peter. The last question I have is actually a follow-up, and then we'll get to speaker with the question for him. And so, Ray, I'm wondering if you could speak to this question that came up from Jennifer on Facebook. The question is, why is the only option wearing a mask? What else can help to stop transmission?
Well, I think it's, thanks for the question, Jennifer. I think it's all the things we've talked about. Certainly, we know that mask wearing is the most important thing that we can do. But we've also discussed social distancing. We've talked about making sure that we avoid gatherings, that we very specifically practice good hand hygiene, and that we stay home if we're sick. And if you're feeling symptomatic at all, err on the side of safety and stay home and don't risk spreading it to others. And then, of course, as has been mentioned, and I think Jill really has been a champion of, make sure you get your flu shot, because that's going to be critically important as we enter into this season.
Thank you, Ray. Last question I have for this block is for the speaker. What do I do when my ability to take care of my family relies on contact with people outside my household?
Yes, I'm thinking that question goes to the workplace environment, and so as we know, the workplace is one of the areas where there is potential for significant spread in our state, and so it's really important for people at work to know that their employers have safety plans in place. And from what I've seen, Hawaii employers have been very concerned about developing and enforcing safety plans because they do not want their employees to be contracting COVID and taking it home to their families. So the safety plan should account for the protocols that we have been discussing this evening: distancing, sanitation, hygiene. Some employers will have their own contact tracing programs in the workplace. So everybody should make sure that they understand what their employer safety plans are. It also includes PPE, and I just want to mention that this past a few months ago, the legislature did provide funding to provide PPE for small businesses, nonprofits, childcare organizations, small businesses that would not be able to afford the cost of PPE.
Thank you so much, Scott. We're going to go to our next break. And when we come back, we're going to look at how it is that, how it is that we take on these issues that are related to a lot of the ideas that we've been discussing, which is what do we need from our leaders and what do we need from each other?
As our 7-day average case counts rise in some of Hawaii's counties, the discussion about a statewide mandatory mask-wearing measure is at the top of local news cycles. Is mandatory mask-wearing the solution? We are currently in Tier 2 for the City and County of Honolulu's reopening strategy. That means that we have to gather in groups of 5 or less when in parks or on trails or even at the beach. Bars and nightclubs are still closed, and many other small businesses in Hawaii have permanently closed. While getting to Tier 3 doesn't seem likely anytime soon, what are the options for us to reduce the 7-day averages and continue to reopen? What can we do as individuals to make sure that we support our families and coworkers in helping them get back to work? And what can we expect of our policymakers to ensure that they use the tools that are available to them to keep us safe and help to reopen the economy?
Track. Another really critical dimension of this is the interplay between our institutions and us as individuals. Policy, together with personal responsibility, can't move our recovery forward without both working hand in hand. And so what I'd like to do is I'd like to start off with Peter Ho and say, when will we have a statewide enforceable mask mandate?
Yeah, that's a good question. And we've talked a lot about mask wearing and all the dimensions around that. I think one thing that's very important to have some sensitivity to is mask wearing it's a personal responsibility. It's a layer of protection, if you will, and Ray did a great job describing all the different layers available to us. But there are other elements to mask wearing that are important as well. So the ability to communicate when masks are required is important. The ability to enforce a mask law, either through law enforcement or for small businesses, is really important as well. So I hope very shortly that we'll have a statewide mask mandate, not because we should be stepping on the toes of the counties, but because it's just the easiest way to provide a simple solution to our broader state.
Thank you so much, Peter. Ray, I'd like to ask you, why are we being so reactive instead of proactive? The example is, what are the shifts taking place that allow our institutions to be proactive in our COVID recovery? And what are our private nonprofit sectors doing to help individuals and families?
Thanks, Naʻalehu. That's again another complex question. First, I have to say that at least from the vantage point that I've been able to sit in, really since March, there's been a tremendous amount of planning and preparation and proactive activity that's happened both at the state level, at the county level, and in the private sector. That being said, this is a novel coronavirus. We're learning as we go with this. And so if it feels reactive, it's because of that reason. With each day, we learn a little more than we knew the day before. My friend Mark Mogishi has described it as we're building a plane while in flight. And I think that's the best way to describe what we're experiencing. Now, that being said, as the science evolves, as our knowledge evolves, so does the way that we combat this virus in each of our communities. If you just take a few examples, if you look at what was happening in the life of the virus, say in New York back in March and April, we were seeing that the percent of people who had coronavirus that were in the ICU was about 8%. During the most recent surge in states like California, Arizona, Texas, Florida, that number was 3% or less, and we've certainly experienced less here in Hawaii. Similarly, if you look at New York back in March and April, the rate of deaths from the virus was about 1,800 per million. Today, in the most recent surge, we're seeing well south of, say, 300 per million deaths. And that's because of, as it makes its way around the country in various surges, it's affecting different populations, some which are more symptomatic versus some who are less symptomatic. And we have better therapeutics. We know how to care for these patients differently. We know what drug formulations can be effective. We know what therapeutic and interactions can improve the outcomes and the mortality rates related to that. So to your second question, what can folks be doing? Again, I think it's all of us need to be mindful of our personal behaviors, as we talked about. We need to understand what the restrictions are in place, both at the state level and the county level, and be willing to educate and enforce those restrictions. And then again, just help one another along as we see opportunities to make the right decisions during the life of this virus throughout our community. And if we all do those things, I think we'll be a little better for it with each and every day.
Thank you so much, Ray. The next question is for Jill. How are we better prepared to handle the spikes in cases that we saw 6 months ago, like hospital and ICU capacity, medications, contact tracing, and testing?
Wonderful question. And I think Ray just did a beautiful job of setting up the answer to that, because we are, in fact, everyday learning. And one of the things that's wonderful about this community is, as healthcare providers, we have been meeting and discussing and sharing almost on a daily basis from the very beginning. We're sharing protocols. Much of the care that's provided inside Ray's hospitals, our hospitals here at Queens, are on a protocol so that we are identifying what's working, and then when it does, making sure we're communicating that very rapidly. We are working together on staffing. Now, when you look at hospital capacity and if a surge is happening, it's not just the issue of do you have a bed, it's do you have enough nurses and physicians to care for those patients. And a patient with COVID may require more intensity of care than a patient that doesn't have COVID. So staffing has been key. And I really want to thank, again, our state and federal leaders, HHS, HIEMA, our General Harara. They all came to our elbows back in August when we said we need to open up a lot more beds in a variety of hospitals, and brought us in teams of caregivers to help us do that. We're prepared now because we are preparing for staffing beyond what we had as we've had the last several months to look forward so that we have the adequate numbers of staff. We're improving our access to our beds. I know at all of our facilities, everyone's been working at their protocols. I'm very delighted that we were just able to open up at Queens our infectious disease unit, which is a whole unit that is specifically designed for individuals with infectious disease and provides one of the safest environments for our individuals that are ill. Supplies, we have all been stockpiling. We know we live on an island, and so those very important N95 or reusable supplies that keep our caregivers safe, we have been creating together lots of excess capacity in preparation for surges. And most of us are using analytics that say we need X amount based on a predicted surge. So we're constantly focusing on making sure we have enough. And again, having the Battelle machine that FEMA is providing that allows us as a backup mechanism if we need it, are all the things that great communities in collaboration with each other do to make sure you're ready. And last but not least, as Ray described, the medications. We are seeing, and very early, the protocols that are making the difference in people's lives. Remdesivir, dexamethasone, You hear about the monoclonal antibodies and or convalescent serums. Our clinicians have been using those, and they were very far upstream. And so with our recent visits by the Vice Admiral, we were able to procure additional remdesivir, which is a critically needed medication, and it reduces significantly the harm with the disease. So I can say with confidence, all of our health systems are much stronger than we were in March. We are learning every day, and we do not take any day for granted. And the preparations continue with great intensity. And I hope that we don't have to use what we have. I hope that we have over-prepared, but we are not stopping because we will be prepared to care and to have the access you need. Ray,
Thank
do you
you
want
so
to
much.
add to that?
I
Any
think you
other
nailed it.
comments? Okay. We're going to move on to Speaker Saiki. So Speaker, the first question I have for you is, why can't we access more rapid testing for all? And the second question I have is, what happens when the CARES money runs out at the end of the year?
Okay, so for rapid testing, the short answer is that the supply of reliable rapid testing products is severely limited in the United States. Hawaii is competing for rapid testing products along with all states and all local jurisdictions in the United States. We know that as we speak, new technology is being developed, but but that technology also has to be tested and approved and proven reliable. We've seen where products have come to the market and fallen short for the most part. So basically, it's just a matter of supply, and the state has been attempting to purchase as much of an inventory as possible to build up our rapid testing inventory. Second, as far as CARES funds, so there are two tranches of CARE funds that the state received. The first tranche was $1.25 billion appropriation that went to the state and to the counties. Those funds have a December 31st deadline. If the federal government does not extend the deadline for the use of those funds, then any unspent funds will probably revert to the state unemployment fund. And the state unemployment fund at some point will be depleted. So it does require additional revenue so that we can continue paying benefits to unemployed workers in Hawaii. There's a second tranche of CARES funds, which is about $2 billion that does not have a December 31st deadline. And those funds are appropriated for direct services such as food, childcare, juvenile services, family services. So those funds will continue to be spent in Hawaii.
Thank you so much, Mr. Speaker. As we look at building our economy back up and the role that travel plays, it begs a set of larger questions about the national and even international outlook for coming months and how that will affect us here at home. That's up next, our final segment this evening. This video takes a look at some of the national trends that sets the context for this part of the conversation.
130,157. That was the number of positive COVID cases reported in the United States yesterday by covidactnow.org. That, coupled with the fact that the nation's 7-day average of deaths is peaking at over 1,000, it's clear that the continental U.S. is in another surge in this pandemic. In stark contrast, however, Hawaii's case counts per 100,000 are some of the lowest in the nation. Being surrounded by 2,000 miles of ocean, our island home is one of the safest places to be. The 72-hour pre-travel test program was instituted less than a month ago, and while many consider it a success, we're still faced with the potential for more cases as students are headed home from college and other ohana are making preparations to visit for the holidays. We're faced with the delicate balance between welcoming new visitors that the economy so heavily relies on and making sure the best precautions are put into place to keep our communities safe. There are no easy answers. only more work for us to do collectively to ensure our Hawaii continues to be one of the safest places to call home.
Hawaii has a unique set of circumstances because our geography and the strength of our public health infrastructure. We are capable of becoming the safest place in the US. We see alarming trend lines on the continent and case counts, the case studies of great success and unsettling futures throughout the region and the globe. So what does this mean for us here at home? First question is for Ray. Will the national surge on the mainland come to Hawaii now that trans-Pacific travel is open?
Thanks, Naʻalehu. That's a good question. The answer is, of course, the greater the prevalence rate that we see globally, the greater risk that we and every other community are potentially exposed to that. But we do believe that if you look at the impact of the 72-hour pre-travel test program, it certainly adds an appropriate layer of risk along with the other things that we're doing, along with personal responsibilities, along with thermal screening, along with making sure that we have the public health infrastructure in place that allows us to mitigate that risk to a level which we believe, again, allows us to find that sweet spot of balancing both the public health of our community as well as the economic health of our community. Look, we're always looking first at how do we keep our people here in Hawaii safe from the virus. But it's frankly unrealistic for any of us to believe that when we define that term safe, it means that there's zero COVID here in Hawaii. That's just not realistic from an economically sustainable, livable community standpoint. And so we really do have to forever be in that search for that sweet spots where we found that balance.
Thank you so much, Ray. The next question is for Speaker Saiki. Now that the election has taken place, is there more federal relief funding on the horizon?
I hope so. We don't know the answer to that question yet. I hope that the federal government will extend the deadlines for CARES fund expenditures. I hope that the federal government will provide more loans to the states and also additional appropriations for all of the states. It's apparent. It's so clear that state governments, local governments, cannot fund COVID relief on their own. All of the states need federal assistance.
Thank you, Speaker Saiki. The next question is for Peter. Can you help us to understand where we fit nationally with respect to our COVID case count? And should we feel good about that or not?
Yeah, well, we're actually performing quite well. So, I think our geography has something to do with it. I like to think that we're a community that cares about each other, and that's obviously helpful. So Hawaii actually, right as we speak, is probably number 2, the country behind Vermont. We've tended to be in the top 5, so the top 10% of the country. And even when we were having our spike, we were still, I think, in the top half of the country. But whether or not that's good, I think is a little bit beside the point. I think we should be proud of the job we've done to date, nationally speaking. But the real issue is how can we get better? Because as we get better, as we control the virus better and better, that allows people's livelihoods to begin to be repaired. That allows small businesses to go on and prosper. And that allows us to keep each other just that much healthier. I think that's really the big issue, not so much how well are we doing relative to other places.
Hey, Peter, I'm going to ask you a follow-up question from Lori. And Lori asked, if cases continue to increase, like in the rest of the country, is another shutdown of travel anticipated?
Well, I think that the situation has always been that the health and safety of our community is paramount. And so I think as Ray's described it, the pre-travel program, we believe, gives us the best shot at being able to maintain the economy while keeping the community safe. But to the extent that circumstances outside of our marketplace, or frankly, circumstances as we've created here locally dictate, we'll have to react to whatever situation comes our way. I hope that's not the case, because that would be, economically speaking, very disappointing. But it's something we'd have to consider if we got to that point.
This is another question that just came in, and this is for Jill from Betsy, who wrote, how is Hawaii anticipating the likely increases of COVID cases for the holiday season? And is there any planning for that eventuality?
So very good question. I appreciate that, Betsy. So when you look at the surge projections are predominantly coming from behaviors of those of us on the island, going back to work, being in close proximity. There is an impact, potentially as students return. We have a large number of families that start coming back together from the continent, and it comes back again to masking and all the protective measures that we've talked about. But I want to add to that what Ray has discussed about the safe travels. Very important for us to be doing COVID tests 3 days before the person travels. That gives us, as we look at our current positivity rate, we catch a lot of COVID from that perspective if a person is already infected on the mainland, if they have that test at 3 days before or less. Then from that point, it's going to be very much focused on testing for symptoms, assuring everyone's wearing masks, and ensuring that we're washing our hands and keeping our physical distance. So I think the biggest threats to us are actually the number of us that will be gathering and having our holidays in new ways where we want to come back together as groups, and the principles that we discussed as small groups, masks, and clearly travelers who are traveling need to have the test 3 days before. That's going to significantly reduce it. I saw some early data, I think it was the first 2 weeks of our travel program where they were doing post-tests, and the positivity rate on that second test was 0.14%. So very, very low, much lower than what you have in our general population. So we'll keep watching it, we'll keep monitoring it, and all of us will be vigilant, and that will help us. But I do believe with folks coming back and being in families, particularly the students, that's something nationwide that they're watching carefully for.
Thanks so much for that, Jill. I'm going to go ahead and just toss this last question out that we're going to cover tonight to the group, and whoever wants to answer can answer. This is from Dana, and the question is the state using certified contact tracers and that have already been trained? And at what point will the National Guard lose their contract, and how will the state make up the difference in a locally sustainable way with qualified and certified tracers? Anyone?
Yeah, so one of the first things that this COVID committee did was to establish a task force led by Dr. Mark Mugiishi that helped to develop a public health protocol framework. And one of the accomplishments of that subcommittee was to work with the UH School of Nursing. The nursing school developed a contact tracing program, and this was in March. And the program is training and certifying contact tracers. There are approximately between 200 and 300 students who go through the nursing program every year who are could be potential contact tracers. So there is a program in Hawaii that is training and certifying contact tracers. And that's part of the reason why you see the large increase in contact tracers today.
Thanks so much, Mr. Speaker. Ray, did you want to comment as well, or is that okay? Okay. So we'd just like to mahalo everybody tonight. We've gone a few minutes over, and these are really complex issues, and this has given us a start at some of the conversations that are taking place. And we want everybody to know that we're going to do our best to answer the questions that came up in the chat on Facebook or were emailed in at info@covidpow.org. And we're really thankful for the engagement, and we will do our best to get back to everybody. And I want to send a big mahalo out to all of our panelists tonight, Speaker Saiki, Ray, Jill, and Peter. And I'd wonder if you could just leave us with a few comments about what you think is most important for people to know as we leave you tonight. And we'll start with Speaker Saiki.
Yeah, thanks everybody for joining us tonight. Basically, I just want to say a couple of things. First, thank you to the public for your patience as we all work through this pandemic. And second, please follow the basic safety protocols, because if we do that, we can control COVID-19 in Hawaii.
Thanks so much, Speaker. Ray, you want to go next?
Sure. I also just want to thank everybody for joining us and echo what the speaker said. Look, we only get through this in a way that is good for everybody involved if we each do our part. And I think Peter appropriately highlighted that Hawaii has done extremely well relative to other states, and it's one of the reasons that we're lucky we live in Hawaii. And so that is only as a result of the work of everyone in our community, and because of the work in building in the diligence and building a good public health infrastructure. And so if I were to leave you with anything, it would just be, look, patience and diligence is going to be key. This is going to be an evolving process. It's a long game. But I can tell you, as I've watched the response here in our community at the broadest levels, there's no place that I'd rather be living during these times.
Thanks so much, Ray. Jill, any ending comments?
Yeah, we are. Thank you for joining us. We're an amazing community here. We have tremendous aloha, and we have the strength to walk through this together, and we can control it. It takes every one of us. So I'm delighted that we're having these conversations. I think as you look and think about, our speaker is sitting with us, and he's been convening groups since the beginning of this pandemic. We're all working together. I do wish you to stay well. I wish you to have joy during the holidays. And I believe there are ways that we can do that and still have our aloha. Stay well.
Thank you so much, Jill. And Peter, why don't you close us out tonight with any final comments?
Sure. Thank you. First of all, Naʻalehu, thank you for doing a wonderful job. And to the people joining in, thank you for your interest and for your great questions. And I know we just were able to scratch the surface. So I know we're going to try to answer all that we can, maybe through our COVID POW site. I just want to close by saying Hawaii has done a great job to date, and it's been hard, and we still have a long ways to go. So keep it up. And, basically, we need to keep ourselves accountable to each other, government, individuals, businesses, small and large. We owe it to each other and ourselves to keep up with the great pace that we have to date. And I think most importantly, this is hard stuff, and really hard stuff. And we just need to be as kind and as empathetic to our collective brothers and sisters in the community, because we're all going through hard times, and many people harder than ourselves. And we just need to recognize that and dig deep within ourselves and each other to take care of each other. And mahalo and happy holidays, everybody.
Peter, thank you for those thoughtful words. And I just say to our audience tonight, stay tuned. We're going to have at least 2 more of these town halls, 1 each month. And mahalo to you all, and stay safe and have a good night. Aloha.
Aloha.